Hi guys and girls. My name is Matt Marin, one of the physical therapists at West Rehab. This is Miss Ashley. She's one of my patients.
Hello.
Today we're going to talk about mechanical low back pain, one of the more common diagnoses that we see in the lumbar spine. Typically when we do an evaluation for the low back, we try to determine if there's a directional preference, meaning whether or not a patient prefers to flex or extend the back. The majority of the time when we see limitations in the back, it's typically the direction that they need to go in. For instance, if they have moderate limitations in extension, it's kind of the paradox of therapy. Usually the direction you're most limited in and hurts the most is typically the direction that we need to go in. Assuming that I did diagnose Miss Ashley with mechanical low back pain, one of the more common exercises that we have them do is we have them kind of put their hands right on their waistline with their feet about shoulder width apart. And then we kind of see how they respond to kind of some repeated extension, assuming that extension is her preference. So, and what we have her do is, Ashley, I'd like you to kind of go ahead and kind of keep your hips there, knees straight, bring your hips forward and extend back as far as you can go. And that's the most important thing, go as far as you can go. And then have them come on back up.
Okay.
All right. Did that cause any pain? Did it get worse at the end? Did it get better? What happened? Both during and after the movement.
It felt really tight going back. And it felt kind of sharp.
Okay.
Like,
what happened when we returned to the standing position?
immediate comfort.
Okay.
Yeah.
Okay. So go ahead. So typically that's what we get with some kind of extension loss or obstruction. We kind of have pain at end range. Then we come back to kind of the standing position, it kind of subsides. But they still have the lingering pain if they don't continue doing exercises. So go ahead and try 10 of those for me. Same thing, go as far as you can, keep on going, and come on back up. A lot of times, most people actually with a lumbar spine, since it's a weight-bearing joint, they actually respond better to unloaded position. So she's actually in a loaded position right now.
Okay.
It's just a little bit more practical, so we try this first. So we'll kind of see. I won't have her go all the way to 10, so if it progressively gets worse, you can stop.
Okay.
So if it gets worse, then what we do is we have her. Is it worse?
Yeah.
Okay, so go ahead and lay in her stomach. And that's a common response. And usually we're just going to have them lay here for a second or two to kind of acclimate to a different position. And then what we'll have them do is, if it's more kind of like belt line or the top of the hips, we have them place or position their hands about shoulder height. So I'm going to take away the pillow. There we go. And she's basically going to kind of perform like a modified push-up, except for instead of clearing her hips off the table, she's going to try to keep her hips on the table, and she's going to fully try to extend her arms, and which is eventually going to try to extend her back. She'll be able to go a little bit further than standing, probably a little less pain. She'll still have the kind of discomfort typically.
It's more comfortable than...
And then she goes right back down to her chest. And then we typically have them do about 10 to 15 reps, just kind of general rule of thumb.
That does feel good.
And then after we do that, we typically kind of have them stand up, kind of walk around a little bit, and then we kind of ask them again how their back feels to kind of assess the response. We just don't want to assume that it feels better afterwards, even though it feels better during. There's variations or modifications that we can do too. Some people feel like they might need a little bit more pressure, so the clinician can kind of add a little bit of pressure right over the area where it hurts. Or the patient can actually add what we call self-overpressure or lock and sag, where they lock out their elbows and they exhale at the top. So go ahead and try one of those. She's going to lock out her elbows. So go ahead and do a press up and then breathe out while you're up. And you'll see her kind of back sags in a little bit.
Oh, yeah.
Actually takes her further into her end range. And then we have them go back down. But if that still doesn't alleviate pain, then what we have to do is kind of a little bit more modifications and tweaks to the exercises, because some people actually have a lateral component that we have to deal with, and that's when it becomes a little bit more tricky. If you guys have any more questions, or if this doesn't work for you guys, go ahead and kind of see us at West Rehab. We'd be happy to treat you.